2013 Special Year-Round Medicare Advantage Selling Opportunities, Chronic Special Need Plans, Illinois. Important points to remember when watching this video: only available counties in state are shown. All information is for licensed and certified insurance brokers only and is not intended for the general public viewing or informational use. Available Illinois counties: Adams, Bond, Brown, Bureau, Calhoun, Carroll, Case, Christian, DeWitt, Fulton, Greene, Hancock, Henderson, Henry, Jersey, Joe Davies, Knox, Livingston, Logan, Macoupin, Madison, Marshall, Mason, McDonough, McLean, Menard, Mercer, Monroe, Montgomery, Morgan, Moline, Peoria, Piatt, Pike, Putnam, Rock Island, Sangamon, Schuyler, Scott, St. Clair, Stark, and Stevenson, Tazewell, Warren, Washington, Woodford. So what are chronic illness special need plans? Well, they're Medicare Advantage plans specified for specific severe or debilitating chronic conditions, including heart conditions such as cardiovascular disorder or congestive heart failure and diabetes. Plan coverage requirements for a chronic illness special need program are required to offer benefits and care management to address the unique needs of the chronic illness special need population they're dealing with. Benefits must be as good as original Medicare, and additional services must be offered, such as routine vision, preventive dental, foot care, non-emergency transportation, and a benefits product catalog. Most chronic illness special need programs are zero premium. The client must continue to pay their Medicare Part B. The primary care physician and specialists usually come with a copay or a coinsurance percentage on an office visit. Inpatient usually has a copayment or is a fee-for-service schedule. Out-of-pocket maximums do apply. Medical and drug deductibles are usually zero to a fee-for-service. The prescription drug card is included, and the drug tiers will range by copays and coinsurance for preferred and non-preferred generics as well as name-brand drugs. One of the biggest selling points to the Chronic Illness Special Need Program is care management. Care management helps coordinate medical care at the hospital, post-hospital care for your member. They focus on improving and maintaining the member's quality of life. They provide information on how to access the plan benefits and answer health-related questions, and provide health education when needed. They also help members access preventative care like flu shots and annual physicals. Another great selling feature of these programs is the health risk assessment. Chronic illness special needs members will receive a health risk assessment telephonic interview within 30 days of their enrollment in a plan. This is different than the OEV call to make sure they understand their benefits. Questions are asked to assess the current condition of the member and best coordinate what type of care management they may need. A great selling feature. So what are the consumer characteristics of someone you'd be looking to sell one of these plans to? Well, the market is very large. They have to have one of the qualifying chronic medical conditions, such as a heart disease or diabetes. This is a client that wants to reduce their medical cost. They want the benefits from the additional coverage, and they want predictable cost. They want benefits to care coordination will bring them, dealing with multiple providers, and also the great care management that we discussed before. In order for a person to qualify to enroll in one of these great chronic illness special needs programs, they must be entitled to Medicare Part A and be enrolled in Medicare Part B. They must have one of the qualifying chronic health conditions we discussed before, and that has to be verified by their physician on form in 21 days of application. They have to reside in one of the plan's service area counties, and they must not currently be treated for end-stage renal disease. And since this is a year-round selling opportunity, switching programs is very easy. Someone could be on original Medicare and have one of the qualifying health conditions and come onto the chronic illness special need plan. They could have a current Medicare Advantage program that doesn't deal with their specific situation, and they can switch to the chronic illness program and deal specifically with their chronic illness. They could be on a Medicare supplement plan and switch to chronic illness, saving premium and also getting the care they need. The chronic illness verification step is the most important part of this process outside of the application itself. It will determine the eligibility of your client to be enrolled in a chronic illness special need plan. The form is included in your application packet. It's going to have to be verified by their physician 21 days from the enrollment submission. Client can assist in getting the information and help you get it back to the company. There is no coverage until a verification form is received by the carrier. Here's some final takeaways for you to consider when thinking about selling chronic illness special need plans. This is a year-round Medicare Advantage selling opportunity. It's a target marketing opportunity to a large population of people. It's got the same commission as a regular Medicare Advantage plan, and switching people is easy, and it's also very beneficial to someone with a qualifying chronic illness. If you've liked what you've seen in this video presentation, you'll ask what to do next. Give us a call at 800-283-0040 to discuss carrier contracts and answer any of your marketing questions when dealing with the Chronic Illness Special Need Program. Once we receive your contracts, you'll get an email confirmation from us. In 7 to 10 business days, you'll get a welcome email from the carrier. Certification is required to sell the Chronic Illness Special Need plans, but the good news is AHIP is accepted if you've done that. In the meantime, go to our homepage and watch the community meeting videos for a great prospecting seminar program that will help you sell even more chronic needs plans. We'll order your supplies, and then you'll get ready to sell. I'd like to take just a moment to tell you about us and our FMO partner. S.A. Nichols Brokers was established in 1992, and we specialize in the wholesale Medicare marketplace nationally to independent brokers. Our regional broker service office goes coast to coast with live service up until 8 p.m. Pacific Standard Time on Friday evenings. Our FMO partner will even give you free Attorney 65 lists and much, much more. This is Scott Nichols of S.A. Nichols Brokerage thanking you for taking the time to watch this video. We hope you'll join us for this year-round Medicare Advantage selling opportunity with chronic illness special need programs. Good luck and good selling.